So here we will discuss about a few drugs which are known as vesicular monoamine transporter 2 inhibitors. So we all know in the neurons, the neurotransmitter is stored in the vesicle. Like if we talk about noradrenaline, it is stored in the vesicle. But how noradrenaline is produced in the vesicle? We know tyrosine comes from outside. This tyrosine is converted to dopa, which is converted to dopamine, and dopamine will enter the vesicle and forms noradrenaline. Then this noradrenaline will be released and then work on the receptors. This we all know. Now important thing, the transporter which pushes noradrenaline into the vesicle, the transporter which is present here, this transporter is known as vesicular monoamine transporter. So as the name says, monoamine transporter, that means it will transport the monoamines like dopamine into the vesicle. But special thing to remember, this transporter is non-selective, means it not only transports dopamine in the vesicle, but it also transports serotonin in the vesicle. So if we inhibit this transporter, we can decrease the entry of dopamine. So noradrenaline will not be produced, sympathetic activity will decrease. But we will also decrease the level of serotonin. So we can cause a deficiency of dopamine, noradrenaline and serotonin with the help of these drugs. So first of all, what are those drugs? The important drug first of all formed VMAT 2 inhibitor was reserpine. And after that we formed 3 more drugs whose name end with benazine. The drugs are tetrabenazine, deutetrabenazine and valbenazine. All of them are VMAT 2 inhibitors. Reserpine was the first drug. It was developed as antihypertensive drug because it was decreasing noradrenaline, BP decreases. But it was also decreasing serotonin, and deficiency of serotonin can lead to depression. So many people committed suicide on reserpine therapy. So reserpine was withdrawn. It is not used nowadays. So newly developed VMAT 2 inhibitors are tetrabenazine, deutetrabenazine and valbenazine. Tetrabenazine and deutetrabenazine, these are used for conditions like Huntington's chorea, which is due to excessive dopamine. So they will deplete the dopamine because dopamine will not enter, so dopamine will finish. So used for treatment of Huntington's chorea. Whereas valbenazine, it is used for tardive dyskinesia. Only approved drug for tardive dyskinesia is valbenazine. We discussed in the endocrine, this CNS also. Tardive dyskinesia occurs due to super sensitivity to dopaminergic receptors. Okay, so that is important about VMAT 2 inhibitors. Okay.